The information shared on LightBody Radio is for educational and informational purposes only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed healthcare provider, or qualified wellness practitioner with any questions you may have regarding a medical condition or health goal. Dr. Lara May, her guests, and affiliates do not claim to cure, prevent, or treat any condition and are not responsible for any actions taken based on the information shared in this podcast. By listening to this podcast, you acknowledge that you are responsible for your own health decisions and that any actions you take based on the content are at your own discretion and risk. Thank you for tuning in to LightBody Radio.
Welcome to LightBody Radio, where science meets soul and healing gets multidimensional. I am your host, Dr. Lara May, functional medicine pharmacist, master intuitive Reiki channel, and certified life and health coach. Here we decode root causes, transmute stuck energy, and empower your full spectrum healing journey, body, mind, and light body. This isn't just wellness, it's awakening, grounded in science, guided by spirit, and designed for your evolution. Let's rise and radiate. Welcome to the next level of you. Hello, everyone. Welcome back to Wellness Illuminated with Dr. Lara May. I am your host, and today we are continuing our February focus on nervous system regulation, emotional resilience, and of course, cellular safety. So this is an episode that I've been receiving a lot of questions about lately, and so I thought this would be the perfect platform to dive in and give you more information. And so today we are talking all about methylene blue. What is it? How it works in the body? Why is it being revisited right now, both in the functional medicine world, the longevity medicine world, and actually allopathic medicine as well? And so we want to think about it from a perspective of safety, intelligence, and educated awareness, of course. So this is all about education. This is not medical advice. This is not meant to treat, diagnose, cure, or any of those things. So for all of those lovely platforms out there that like to sort of, make this information hard to find, just saying up front, this is educational purposes only. My goal is for you to leave with clarity and discernment, not hype or overwhelm. So why methylene blue and why now? And let's just sort of talk about, I think what a lot of people are feeling and moving through, at least what I see right now, whether it's with coworkers, friends, family, clients, there is this persistent fatigue that's happening. There's brain fog that doesn't seem to go away no matter what we do. There's some level of low motivation or emotional flatness. There can be anxiety without clear triggers. And there's also this just overall general nervous system depletion after really pushing hard for, a period of time, whether that was through the holidays and through New Year, and now we're in February, and you're finally starting to see the culmination of all of these signs and symptoms come up for you. And so a lot of times I think it's important that we separate these things, because oftentimes we think of these as being a willpower problem or a discipline problem, but really it comes down to mitochondrial inefficiency. And even when we talk about the concept of burnout oftentimes will manifest in this way and with these feelings and these symptoms. But really, when we get down to the cellular level, the physiology of what's going on in our body, the biology, it's mitochondrial inefficiency. Our mitochondria are not just our energy producers, but they are also our stress sensors. They're our redox regulators, and they are a signaling hub that directly influences our nervous system function. So it's really important that we understand the gravity of the function of the mitochondria in our body. So when the mitochondria are struggling, our nervous system is going to try to compensate for that. And that compensation shows up as burnout, anxiety, poor focus, emotional reactivity, and or chronic exhaustion, or a combination of all of those. And so this is actually where methylene blue can come in and be a very interesting factor in the equation, if you will. So what is methylene blue? Methylene blue biochemically is a pharmaceutical compound. It has been used in Western medicine for over a century, so it's not new. And what is new, though, is how we understand it and how we understand its function, and actually how we understand mitochondria themselves at the cellular level. So that is kind of what's new, and that's what's causing this resurgence and this renewed interest in the role that methylene blue could have. So at low, carefully selected doses, methylene blue functions as a reversible redox agent and electron cycler. And that means that it helps move electrons more efficiently through the mitochondrial electron transport chain, so that ETC. And so it helps provide sort of the fuel that the mitochondria need to make that electron transport chain work seamlessly and to really produce the ATP that's needed at the end. But let's unpack this a little, because I know, some of you might be having flashbacks to Bio 101, and that's okay. This is a safe space. So inside your mitochondria, we're going to jump into the biochem here a little bit, but I think it's important that we understand that we demystify the role of methylene blue. Like that's to me, what makes functional medicine fascinating is that it actually, most of everything we talk about on this show has a biochemical foundation, and we can see how it works through the pathophysiology and the biochem in the body. So that's where this piece is coming in for us right now. So inside of our mitochondria, energy is produced through a process called oxidative phosphorylation. Electrons move through the electron transport chain from complex 1 through complex 4. And that is creating a proton gradient that drives the production of ATP, which is your body's cellular energy currency, essentially. And so under stress from inflammation, infection, toxins, trauma, chronic sympathetic activation, so that fight or flight way of existing in the world, this system can become overwhelmed, and it can become broken down and inefficient. And so electrons begin to sort of be pulled away, or they leak, or whatever kind of wording you want it to assign to it. But the electron transport chain itself stops working as efficiently as it should, or as it can at its full potential. So instead of producing ATP, we start to generate these reactive oxygen species, and this increases oxidative stress, and it actually reduces the amount of usable energy available to the body. So I hope you got all that. So anyway, so essentially the Cliff Notes version is, under stress, our ATP mechanism that happens in the mitochondria through that electron transport chain is impaired. It doesn't function as appropriately. You don't get the amount of energy out of it that you should. So how does methylene blue factor into this? Methylene blue supports the system by accepting electrons where there is congestion, donating electrons where there is deficiency, and it can bypass dysfunction at complex 1, and it supports electron flow towards complex 4. And so this results in improved ATP efficiency, reduced oxidative stress, improved mitochondrial resilience, and lower cellular energy cost. And this is why methylene blue does not behave like a stimulant. So, a lot of times when we look at other supplements, they don't really get to that biological and that physiological root cause. They actually maybe mask the symptoms by stimulating your body in another way. But methylene blue gets directly to the source. It directly interacts with that electron transport chain and helps the electrons go and protons go where they need to go to help optimize that function in the body. So it improves efficiency and therefore improves a myriad of other functions in your body. So why does this matter specifically for the brain and the nervous system? So the brain is one of the most energy demanding organs in the body, if not the highest energy demanding organ in our body. And although it only makes up about 2% of our body weight, it consumes 20% total oxygen. And so that's a lot if you think about it. So even small drops in ATP production can show up as brain fog, anxiety, mood instability, poor focus, cognitive fatigue. So methylene blue supports cellular oxygen utilization, meaning oxygen is more effective at the mitochondrial level. And this is why it has been studied in neurological and hypoxic conditions, not to stimulate the brain, so to speak, but to support it with that neuronal energetic stability. So there's another piece here that I find really fascinating. It's the nitric oxide pathway and the redox balance. And so nitric oxide plays an important role in blood flow and cellular signaling throughout our body. And however, excessive nitric oxide, especially during inflammation and infection, can actually impair mitochondrial respiration. So methylene blue can actually step in and help modulate the nitric oxide signaling, which restores balance without completely suppressing the pathway. And this mechanism is one reason that methylene blue has been used in even acute medical settings for years to help modulate this pathway. So methylene blue is not fringe. It might seem like it is currently, but really it's not. It has been used for decades and decades in conventional Western medicine, and particularly in hospital and critical care environments. We actually use methylene blue in septic shock. So again, this is all about the nitric oxide pathway. So where excessive nitric oxide disrupts vascular tone, methylene blue can help step in and mitigate that. It's also used in cardiac and major surgeries to support blood pressure and cellular oxygen utilization. It can also be used in methemoglobinemia, a condition where hemoglobin cannot release oxygen effectively. And there is also some implications in critical care and anesthesia. So when the mitochondrial failure becomes life-threatening, methylene blue is used to help, again, mitigate those failures and the inflammation pathway that's happening there. So in these settings, methylene blue is used because mitochondrial dysfunction can threaten our survival, and it does when it's allowed to get to a certain level. And so from the functional medicine perspective, though, of course, we are looking at prevention, right? So we ask the preventative questions. So we ideally don't let it get to these severe stages of shock and surgery and critical care. But we want to know, what if we supported our mitochondrial function along the way before the body reached crisis mode? And so in functional medicine and longevity medicine as well, methylene blue is explored at much lower doses and with a very different intention. So the focus from the functional medicine perspective and really the perspective of this podcast is not reactivity, and it's not acute rescue, but it is more on fine-tuning and rebalancing. So mitochondrial efficiency, how can we rebalance that? Nervous system stability, how can we provide that for ourselves? cognitive clarity. How can we bring that back into balance? And long-term cellular resilience. So when we are stressed or introduced to that stress, our body operates better with it. It is more resilient. So same compound, different goal, and again, very different dosing. And again, I just want to reiterate, this is just for educational purposes, but it's really to show you the contrast and the difference between the two approaches. And because methylene blue is a dose-dependent compound, so at low doses, it is supportive of mitochondrial efficiency. If at high doses, it can actually increase oxidative stress and disrupt mitochondrial function. So even when we're using it in acute care and critical care medicine, it's very important to pay attention to that dose and what is going on with the patient at that moment. So more is not always better. And it is, it should be like very patient specific, very client specific. And that's why if you are a client listening to this, then as always, I recommend you find a practitioner to work with to help guide you through this so that you're not, feeling around in the dark and maybe doing more damage or harm than good. But the functional medicine approach emphasizes microdosing rather than macro. Very conservative initiation. So that means we start at low doses and we titrate up slowly as appropriate and as tolerated. And then you can also cycle on and off, which means that you use it for a certain amount of time and then you take some time off and then you may go back to it if you find that you want to or you need it. And this also helps, assess your nervous system's readiness, because that's something else that as a functional medicine practitioner that I do with my clients is we start the compound, we titrate the dose, but we also document and we track how the client is feeling and responding. And so ideally you have less brain fog, you have more energy, you have more resilience to the inflammation that you might be exposed to throughout your life. But if you start to notice that you're actually feeling more tired or more moody or more short-tempered or more exhausted, then that's a sign that we need to stop, back off, maybe even give you a little reprieve, a break, and stop it altogether. So methylene blue should never be used to override exhaustion or to compensate for inadequate sleep, nutrition, or recovery. This is something that, again, you should always have your foundation, your baseline, which is that good sleep, good nutrition, and good recovery practices. And then you can add this on as sort of like an optimizer. And so it's really there to support capacity, not again to fill in for where you're still having deficiencies in your foundation. And methylene blue is not appropriate for everyone. So let's move into that too. Who should maybe avoid this altogether? So if you're taking any SSRIs, SNRIs, MAO inhibitors, or any other psychiatric meds, methylene blue is not for you. You should avoid it. If you have a history of serotonin imbalance or serotonin syndrome, avoid methylene blue. If you have significant nervous system dysregulation, methylene blue is not for you. If you're pregnant or breastfeeding, no methylene blue. If you have G6PD deficiency, no methylene blue for you. And if you are using it to push through burnout, no, not appropriate use. So because methylene blue affects our neurotransmitters, our redox balance, and our mitochondrial signaling, medication interactions are clinically significant and must be reviewed by qualified practitioners. So discernment really matters here. So this is definitely not something that, you should just go out there and buy and try without working with a practitioner. It is, I think, extremely important to work with someone that understands not only the pathophys, but the other implications of everything else that's going on with your body. And if you are on some of these medications, it's just not the appropriate tool. And that's okay. There's plenty of things in this world that are not, one size fits all. And this just happens to be one of them. So if today's episode sparked your curiosity, I have created a free downloadable guide. I, creatively called it Methylene Blue 101. It goes over the science, safety, and the implications with the nervous system. It walks you through how methylene blue works in your mitochondria, how it's used in Western medicine, and how to think about dosing it with safety from a functional medicine perspective. But again, it does not provide specific dosing strategies because it is not meant to treat, cure, diagnose, or any of those things. It is an educational tool that you can bring to your practitioner and you guys can go over it together. So if that interests you, definitely shoot on over to the show notes page at drlaramay.com/podcasts. Look for the Methylene Blue episode and it'll live there for your enjoyment, for your resources. And so again, like just within the whole context of my show and my approach to my practice and to functional medicine in general, like we want to be able to support our body with all of the things that are appropriate for us. So I wanted to bring this conversation forward today because it is something that is happening, and I wanted to make sure that there is good information and that there's clarity out there. And so we talked about who it's for. We talked about who it's not for. We talked about how it actually does optimize our own biology and physiology, which is great. But we also talked about how it can be overdone if dosed too high. So thank you for hanging out with me today. I really hope that if you are looking for some energy restoration and some nervous system regulation, that you might consider this with your practitioner. But make sure that you, again, go about this with intentionality and conservatively, because, again, it's not a shortcut. And so we want to approach our healing journey from a place of restoration, of efficiency and safety, not forcing or overpowering or overriding. And so if you'd like more personal guidance or support integrating tools like these and like peptides into your healing plan, you can definitely reach out to me, shoot me an email, sign up for my my newsletter, or you can even leave a comment of wherever you listen to podcasts, and we're happy to reach out and support you, get in touch, see how we can help you here. So thanks for being here. Thank you for choosing this thoughtful and informed conversation today, and we will see you in the next episode.
Thank you for joining me on LightBody Radio, where functional medicine meets intuitive healing and transformation happens on every level. If this episode resonated with you, please like, share, and if you're ready to go deeper, visit drlaramay.com to book a functional medicine consultation or an intuitive healing session. Whether you need to rebalance your body, clear your energetic blocks, or reconnect with your soul's purpose, I've got you. You can also follow me on Instagram or TikTok at Dr. Lara May for daily inspiration, energy updates, and healing tools. Remember, your healing is multidimensional, and so are you. Until next time, honor your body, trust your intuition, and activate your light.